I ended up in the middle of war, and my first job was to make sure in the emergency room who died and who alive and who needs a surgery and who doesn't need a surgery. That was my first job in my life. And that, initially I was mad to my parents who allowed me to do that job. Then I realized it's my state I have to be mad, who couldn't protect me. My state who fell, made me as a teenager to have nightmares I still have today. So as a teenager, as a 15, I saw my mother struggling, shortage of healthcare professionals, and I didn't have a luxury. I had to jump in and learn, perform over 50 deliveries. My school was delivery tables, not in universities, not in beautiful classrooms. It was share of necessity. It's not something luxury I had or I want to do it. I'm interested to be a doctor. By the way, I wasn't interested to be a doctor. My mom was making, I want to be a teacher. And my mom was like, I'm building a school, hospital, who's gonna run? You have no choice. And everyone in this room understands a Somali mother. It's like, no. There is no way. You will become a doctor. And before I even decided what I want to become, I saw the suffering and desperation and shortage in front line. So I jumped in, and the delivery of 50 babies was not a practice or a beautiful thing that I chose, as I say. It was a raw reality of necessity. 15 years old girl delivering because there's no other hope. Our hospital was located right outside of Mogadishu, the road of Goyo. Who heard or know or been there, everyone who was freed in Mogadishu was going through our road in front of our hospital. So when you're a physician in front line, you are in a war and you're not, because you see all the suffering coming to your emergency room. So that was my surviving. Decades ago, which was a long time ago, as you could see, I'm old enough. That journey and that moment really ignited me a mission, my mission, long-standing mission. I need to find a solution. My medical school was completely different than any of you, because I have seen everything before I went to medical school in Russia, Moscow. When my classmates were thinking, what is this? And I was like, oh, that's why Ahmed died. That's why Ali died. That's why this bone was broken. Because I already have seen everything, and I had to learn how to fix it. And that is still my journey. I'm learning how to fix a broken system of my country. That's the reality. That's the reality we're living in. In 2010, suddenly, my hardworking mother for 30 years and her passion was never recognized. It was recognized when Al-Shabaab attacked us, because it was suitable to the world's eyes. Leading news, Islamic women fought against Islamists. Suddenly, we become famous. We had to run back and forth, receive 24 awards, I count. Hero of Somali, Mother Teresa and Rainbow, that's how they identified her. But their goal and the way they were showcasing our work was very limited and was specific, and it was agenda. So my fight from 2010, it was not only being on the ground and fighting the militia. So my fight was our narrative. Telling my mother is a strong Somali woman, who's a Somali, that's what she says. My blood runs for all clans of Somali. I'm Somali. That was her, what I inherited from her. And she was not only a small window where she fought Al-Shabaab. She was bigger than that. So my goal was to make sure our legacy continues, the legacy of my people. What the hell I did? Can you hear me? Okay. That's what you learn when you're working in a tough places. You try to be also comedian to take away your trauma. So I'm also a stand-up comedian, so sometimes I'm glad you laughed. So the 2010, I was forced to open Hawa Abdi Foundation, register first time. I didn't know what means 501c3. I didn't know how to collect money. I didn't know what to do. People were telling me, oh, you raised 100,000, you have to hire someone. And I said, what the hell are you talking about? I have 100,000 US dollar, I can open a school. I can save a million people. And just like, no, that's not the way it works. I was fighting for 10 years, but now I realize, I wish I could listen sometimes. The institution and nonprofit world is a whole different ball game that I learned because of the necessity. It's not I went to school for it. So I learned how to map, how to write a proposal, how to become a professional beggar. That's what I say. I become a professional beggar. And the funny thing is the people I'm talking to and asking money are American, and they're telling me, you are doing amazing work. Oh, yes. I told you what I did, and you didn't fix it. Okay. Let me see. This way, it's better. I could do better than your job. I could do better. Okay, anyway. I'll leave you there. So what I learned is nonprofit world is funny, and the people I'm asking money, they don't even understand where I'm coming from. They telling me I have to write indicators showing my government the benefit and the life-saving and the resources and an economical thing I'm doing so they can fund you or give you a safe. I was like, I'm sorry. My Minister of Health has no idea what I'm talking about. He doesn't even know what he's doing. He doesn't even realize how he ended up there except the clan issue. And he doesn't even get the magnitude of the country's healthcare. So how he gonna listen to me? So that's what I'm dealing. And secondly, the funding was a struggle. Then I realized every time I talk to these donors, they ask me data, numbers, statistics. I go online. Each of you, if you could go online and look Somalia data, you will see OCHA, WHO, someone did it. We don't have data we own. We don't have research we did. And that's why I started Hagarla Institute. I was very passionate. I'm very happy. We haven't published much, just for...
Presentation's working fine.
Okay. And that's my mother, training young people. Can you go next slide?
Yeah, just on.
Yeah, thank you. Stay there. Stay there. Now I can focus. This presentation is my guiding of focus. Otherwise, I'm going to talk until tomorrow. I am Somali mother. What do you expect? So today, anatomy is my favorite subject. I want to share with you. And autopsy comes with anatomy, as you're aware. If you want to understand the issues, the patient's death, we need to do autopsy, isn't it? That's how we learn. So today, we're going to do autopsy of failed state Somalia. Let's do dissection and everything, okay? So what means failed? It's structurally one healthcare system collapsed. Global human cost. Fragile state, if anyone here fragile state? Or you ignore when you see that coming up in your feed? You're Somali, you try to ignore the pain. Fragile state, failed state, I don't want to care. I'm American. But it's reality. Next slide, please. I hope today what we learn, we can come up with a blueprint to solve the issues. Because when we dissect the patient, I hope we can come up with the solution why he died, not to die what he... And I want to make sure fragility is not about the government or statistic or social study. I want to make more human to you. What means a fragile state in a human stand as a doctor? For me is the pain that my patient go through and myself as a provider. I want to share with you Asia's case. And also, it's not something only for Somalia. Fragile states and broken states 2 billion people worldwide living in that environment. 2 billion. It's not a joke. It's a 24% of worldwide population. It's a large. It's not only for us. So if you always thinking fragile and failed state is only Somalia and Yemen and all that, no, it's a 2 billion people suffering like Somalis or maybe even worse than us. So I wanted you to have the context of how big this is. So I want to share with you Asia's story. I hope I have enough time.
Oh, yeah.
Asia was one of my patients when I came back home in 2007. I was excited. I found a job in MSF. I was working in, I am not a pediatrician, or infection control specialized, but I was working 2 departments of MSF in the morning, making sure people don't die for cholera and taking care of pediatric department. And afternoon, I was working in my mother's hospital as a gynecologist. Asia comes to me in that afternoon, bleeding. Nurse coming to me, screaming, oh, her hemoglobin is 3. She's severely anemic, and she is O-. We don't have blood. She's literally bleeding, like you open the faucet. And she's 12 weeks pregnant. I told them, let's rush, do DNC, and find the blood. I'm doing screaming, yelling, we should have a blood bank, we should do this, blah, blah, blah. All the knowledge and skills I get from West. Trying to be, I know everything, this is the way it's supposed to be. I'm yelling to Asia and telling, please do not get pregnant. We hardly find your blood. Somalia, we have a human blood bank. We don't have blood banks. I was screaming on her, saying, you cannot do this to yourself again. She goes. After 3 months, she comes again pregnant, bleeding. I'm screaming, please don't come. If you want to die, you cannot come to my clinic a 3rd time. The boss. It's like, I just told you, you cannot get pregnant. You cannot have a children. I lectured her. I remember, I'm still ashamed. I was walking at the bedside and she holds my hand, Dr. Deqo. It's till today, I tear up. And that was 2007. How our state felt. She tells me I have 6 orphanages. I married 2nd husband. If I don't give him a child, he will leave me. And I don't have capacity to feed my other 6 children. Tell me. And people sit here and talk about the clan and bullshit division. When our mothers are dying, just to get $2 a day. $2 to feed our children. So that is the reality. That's the reality of Somalia. We don't have luxury to be just a physician. I don't have luxury just to treat. I don't have supplies to do it. And my agony of Asia stays with me all the time. Sometimes it paralyzes me. But there is hope. And I hope today we're going to get the hope. Next slide. Okay, let's go politics. This is more fun. We're going to do this. So we know fragile state because the government failed, isn't it? We fell. It's a core political failure. It's a zero capacity, where fragility is between intersection of you have terrible crisis and you have no ability to deal with it. And Somalia is the best of that. They have zero capacity to manage anything. And the 3 main things that causes is the government breakdown, systemic fragmentation, and resource chaos. And all this, we have it. And I want to do next slide, take a sample of each of them from reality, the countries. It's not only for Somalia. If you see Yemen, 50% of their facility is non-functioning, and that caused chaos and division. And poor of providing services. Very interesting, because when you look at the fragility, it's worldwide. It's every state. I love it. I enjoy doing research. And when I look Latin America, Asia, Europe, now thanks to Ukraine, we have fragile state in Europe who hardly under the war. I wouldn't say thanks to, but it is everywhere. You can feel it. I just wanted you to understand how big is this. An economical shock. Venezuela collapsed by hyperinflation and the money and issue. Their people flee to U.S. and everywhere. It collapsed because there's a lack of human resources. And the queen of all is Somalia. It's completely failed state, complete collapse. It's anarchy for 35 years. And I'm ashamed of it sometimes, just calling myself. How we can have these brilliant Somali people all around the world and we cannot fix. Sorry for my language, we cannot flush our shit. So that's the reality of Somalia. Next slide. Trying to be funny. So I wanted to find, that's the anatomy. I think we dissected. Do we know the problem? I'm trying to imagine to make it fun and find a solution for this. And this is my own understanding and pain and research for last 20 years. And this 3 area, I think, is the key for everything. This is essential pillars. It could be million, but this is the way it is, and really the way it goes in order. Because we failed because of the leadership. We failed because we don't have leaders. And next slide. I want you to reimagine leadership from authority to stewardship. That's what we're missing, the ownership. Our leader who owned the problem, who tried to solve the problem, who tried to find how we can solve this issue. Because I don't know how ASEA cannot affect them. It affects me. It was 2007 till today. It's my core mandate of work, and I just remember ASEA. I cannot sit down, even if I want to take a break. So we need to have leaders who have from accountability. They love their country. They want to fix their country. It's not about political games. It's not about names. It's not about clan. It's not about all above. It's a human life. And subhanAllah, forget about the world. When you go in the front of Allah, you have a question to be asked, what you have done with your leadership. And it's very tricky. I don't know why people still apply, running in offices, when I know I have a question to be asked. People come to me, oh yeah, why not you become this, that? And I say, I don't want to stand in front of Allah asking me why I haven't provided service for ASEA. I cannot take that responsibility. I'm struggling myself and my own children. That's enough question to be asked. I don't want to do anything else. So I want to talk about my favorite country, Rwanda. Let's have fun. Everything is not gloomy. And there is a country who did it. We say, oh, how we can do. Maybe you're a little bit depressed, like how are we going to do it? What happened? Somalia, it's broken, da-da-da-da-da. We took all our problem to Minneapolis too. I know that. I'm not touching there. So let's have my favorite model. I call Rwanda model. Rwanda, I don't care what the West says. I'm sorry if even someone from U.S. government was sitting there, I will be telling. Because I went to Yale World Fellow in Yale. During my fellowship, we had Kagame come and give a lecture, what they call Coca-Cola lecture. They invite the presidents. And everything they were accusing was the human right. He broke human right, whatever they call, I don't know what rights are in a Western ideology, whatever. Not go there. Kagame, it's amazing. I don't care what he did, but what I saw as a physician, as a doctor, as a teacher who teaches African Leadership University in Rwanda, Rwandan people and their leader, they had a courage and a will to say no, to go forward, to unite, and say, no, we will not be identified for genocide. So I hope I will have a day when Somali will say, we will not be identified by our clan division. And we are Somali and we're moving forward. I hope that day I will be alive. And Rwanda, their self-resilience, their commitment, it's unheard of. I don't even know how to explain how they are brilliant and they are amazing. Next slide. I want to talk about equity, which English, it's my fourth language. I don't understand, and I'm not trying to find words. I'm not trying to find a job here so I can speak perfect English, so I'm going to speak plainly. There is no equity in Somalia, nor even the world. So we have to stop telling ourselves the false narrative and idea, oh, there is equality, there is equity, there is none. Please, it's a bullshit. There is interest, there is a misogynistic system in my country. The first thing Somali man will tell you, naga time hakum ana gabada. Nag aqligeed Mohamed soo qaade. And if 100 of them go together, they not even go to one narrow synapse of your brain. One, not millions, hundreds of them, but they still undermine you because you are a woman. So what I learned, I take that weakness and made it working for me. Because man, they don't see me a threat. I'm just a woman. Nagwa, arur kabawen malijere. Yeah, I'm okay, but can I explain to you? Will you able to listen to me? My ideas, he will. But if other man comes talking to the one of warlords or minister, he sees threat because he's a man. I'm not threat to him. So that's the way I use my skills in Somalia. And building a gap. And they don't understand what means equity and how to build a gap. We don't want to, bullshit Western NGO coming and saying human rights, we will give like 23% women in parliament. They cannot even have a food to take care of their children. You should give them financial freedom before you talk about the office. We have to make sure every mother in Somalia, woman, has a financial. I'm not making her to be rich. At least make sure she can feed her children. Before you come, put me in a table, 100 million project to put Somali women in the parliament. Because we don't have leadership. Because we are not Paul Kagame who will say, no, I don't want this. Paul Kagame closed and kicked out from Rwanda 200 NGOs and churches because they were not fit in his mission. Do we have the capacity and guts to say no? No, we are beggars. If someone brings $100 in front of us, the minister will stand and say, okay, how I can steal this $100 and give $10 remaining to the society? Their brain goes straight. You having conversation with them, with moringa trees. I'm doing research with Toronto University. And I'm saying we have to make sure every mother can have one moringa tree for nutrition, for water purification. And the first answer he comes, guess what? How we can package it and make it aid. Their mind is only aid. I'm telling you sustainability and freedom, having and her background, taking care of herself. Why you need to package it and sell it and put it in the camps and take their dignity. So Mohamed, this one I will dedicate to you. You were talking last 2 days, we were together one day, like, no, come back. Saying decentralization, I just decentralized this organization is the key, and trust. Again, I'm taking Rwanda case. US doesn't have that access. Rwandan people, 90% have insurance, 90%. Do you have, all of you, in US? No, not even close that numbers. Okay? Rwandan people trained the Rwandan government 45,000 community health workers to build the trust and proximity to people who need it. And guess what in the statistic numbers in WHO? It's supposed to be 1 or 2 in 1,000. Rwanda is 3 in 1,000 family. So they doubled whatever statistic was there for a short time. So Rwanda did it, we can do it. We can do it. That's what an ultimate lesson, next slide. Equity is not an idea, it's the core mandate to measure how resilient is the system. And I don't think so we have that. Next slide, please. How we can foster innovation that fits us, that's us. Again, I will have my favorite country, Rwanda. I just visited last month. When I went, I should be putting that photo here. When I went to that building, it says Rwandan Health Intelligence Center. I felt I'm going to a CIA interview. It's like, are you really kidding me? Intelligence Center. And when you go in, any of you who have a time in China is an opportunity to visit, has to visit that center. And you can Google it. They have a website. You can look at it. Thank you. So what they did, it's unbelievable. They have a live data in every health center, in every midwife, in every social, and they can right there identify, prevent, target. It's like they were showing me if woman dies in major referral hospital, they can track down where was the issue. Is that she was late in district, or that doctor didn't diagnose well, why this patient died there, where it came from, the issue, and investigate and take care of it. Do you think we can reach that? US did it. I say United States doesn't have my data. I live in Atlanta, Georgia. They don't even know if I'm sick or alive or I died. But Rwanda knows and cares for her people. And it's one thing I was like, the fascinating part, I was like, where did you get this? Where do you get like registration of patient, of electronic, whatever. And they looked at me, they say, everything is made here. Every app we're using, every data, every center is made by Rwandan in Rwanda. We don't need iCloud or US base or anything. And I was like, oh my God, can I work for you? This is where I have to be. Yeah? No, I'm good, thank you. He knows I break a couple bones. Oh, thank you. Next slide. So this is my conclusion. I think I'm almost done. I don't know what to say. I can talk until tomorrow.
Keep on going.
But we know crisis will happen. And crisis happened in 2020. We know COVID-19. No one cared about us. I was leading Somali national call center and trying to make sure people were to go navigating with a team of 20. No one cared about us. Every country was suffering itself. Africa, forget. Somali, who cares? You're going to die. We were lucky. But crisis will come and everyone will care itself. So we have to make sure. Learn and deliver the right way. So I think as long as we're not building these 3 areas, nothing will happen. We have to make sure we have radical equity, accountable stewardship, and contextualized innovation. I don't need someone to come. I do review Grand Challenge Canada proposals for them as external reviewer, or lived experience reviewer, what they call me, because I lived in a war zone. And I received million proposals from Harvard, from Johns Hopkins, from whatever university, telling they had no idea how to solve issues in Africa. Innovation, humanitarian things. No, they don't know. They have no idea what I need, and we have to own it, and we have to bring innovation like Rwanda that fits for Somalia. I don't care if it fits for your Qabil, but make sure it fits for Somalia. Shati Somalia in Ugilisan innovation ke imanayso Somalia dhexdeeda. And we know it's, I talked about it. Maanta dhan ka hadlay. I don't even know how to say this. I believe our mandate is clear. Today it's very clear how to build a better global healthcare and not fit for international institutions to send their students to practice on my field, on my hospital. Global health, when you hear global health today, is in every department, every institution in the West. Just to send and study for poor people. That's my understanding for global health. It's very narrowed. But the global health, it's me. It's you. We have to make sure our healthcare is right. It's a political courage, and we have to choose for people who are willing, like Rwanda. And we have to unshakable know healthcare is a human right. Human right delivered locally, not outside. Okay? That is my message to you. You have to rise this challenge when I disagree. There's so much challenge. I feel as I get older, world is getting better, but it's getting worse. You have a huge challenge. We are waiting for you back home. Not only Somalia. There is over 2 billion people are suffering in our environment, exactly like Somali. So you have a challenge. You have build your passion, build your soft skills, be who you are, unapologetically. Okay? Easy. I don't sugarcoat. I say, hey, Somali Makan, do you know Russian? I speak Russian. Do you speak Russian? No. Do you speak Somali? No. This is my fourth language. I'm not gonna, but I learned how to deliver my message. The main thing you have to learn how to deliver your message very simply. Not trapped in the world of Western language. Speak well. You're born here. That's a benefit. But the main thing, no matter how you even speak the language, if you don't know how to deliver your issue, your pain, and share your narrative as you own it, I will not bring here WHO data. That doesn't concern to me in OCHA Somalia. I will tell you, we don't know nothing how many mothers are dying. It's a bullshit. We don't even have a statistic how many people are Somalis on the ground. We have nothing. You have a country where you can innovate and own it and be there. I'll see you there all.
We'll do a 5-minute question and answer session. Is that okay?
I'm ready.
I'll put the speaker on everything.
Question, answers. It's my first fun part.
All right, guys, we're going to get interactive. We'll pass around the mic. If anybody has any questions, now's the time to ask. Dr. Mohamed came all the way from Somali, so
thank you.
Make that long flight worth it, inshallah.
I made worth it. I was asleep in hall yesterday.
I'm Sabrina. I'm kind of curious. I'm really interested in like NGOs and whatnot, and nonprofits. And so I was kind of curious, like, what's the best way to get into that field as someone who's kind of like an outsider who's really interested in working, in East Africa?
I don't want to break your heart.
No, don't do that.
It's the worst place to go. No, NGO's dead. I'm sorry to tell you that you need to create a social enterprise. We have to stop this ideology. Everything has to be free. Everything has to be worked. Everything has to be earned. People have to take the responsibility. You need to create a social enterprise. I hate NGO because it's my life. I will tell you my experience in MSF, which is one of the best. I'm still going to tell you. I am in my hospital working. I cannot print my form to take a history, basic A4 form. It comes from France. My pens come from Spain. My logistic papers come from Kenya. I have to sit not to accept patient, wait until they come. And that spending billions of dollars where my grandchild will pay. Nothing is free. World Bank giving you this money, nothing is free. We paying the money we didn't receive. We employing people who keep us in colonization. That's an NGO. It's an indirect colonization. And I hate it. And I opened my mother's organization out of necessity. But I will never recommend anyone to open a non-profit organization. You better open social enterprise. Make sure generates income, self-sustains. You don't end up me begging. You don't know how it's uncomfortable to explain I need a money. That's the worst thing you could do. It's uncomfortable. So Yushi's here, thank you. I want to acknowledge her. She helps me to write the grants. She's a public health specialist from Yale University. It is painful. It takes hours. I don't have the time. I get rejected all the time. If you want to learn rejection, write a grant. You will be careless if someone rejects you. I have been rejected 100 times. Who cares? Next one. So you don't want to go there. Be financially independent. This is one thing that Somali mothers and fathers never taught us. We think money is nothing. We don't know how to manage it. We don't think how to save it. We don't think our future. No, make sure you think about yourself. Give it, but also think about it. I am struggling because I never learned it. When I was young, if someone tell me you have to take care of yourself, you have a future, you make sure you at least have $100. $100 is nothing. No Somali. You know this is happen. The guilt key they have making you guilty, emptying your box, your accounts. Help, but first you have to help. And I take example for airplane. Put your mask first. That's the perfect example. If I have a mom, you're alive, you're eating, everyone is well.